This is the American Association of Medical Assistants website about the CMA AAMA exam. The Certified Medical Assistant AAMA or CMA exam credential represents a medical assistant who has been credentialed through the certifying board of the American Association of Medical Assistants. The credential is awarded to candidates who pass the CMA certification exam. The CB of the AAMA is committed to impartiality, objectivity, and fairness in all aspects of its CMA AAMA certification program. This commitment is reflected in all policies of the CV and the execution of all policies. Exam eligibility. Only candidates who meet one of the categories of exam eligibility are allowed to sit for the exam. Exam content. The CMA AAMA certification exam is a rigorous exam that requires a thorough, broad, and current understanding of healthcare delivery. The CMA AAMA certification exam content outline provides an overview of the wide scope of knowledge required in general, clinical, and administrative categories. The exam consists of 200 multiple choice questions administered in 4 40-minute segments. This is a CMA AAMA certification exam content outline. The exam candidate's navigation tool for study. The content outline lists the subject matter covered in the CMA AAMA certification exam by topic category. Additionally, the content outline includes the number of percent of the questions on the exam by major content areas. Based on the AAMA 2018 to 2019 Occupational Analysis of Medical Assistants, a new edition of the content outline of the CMA AAMA certification exam has been published. Using research-based data from the Occupational Analysis of Certification Board (CB) of the AAMA, condensed subdomains within the content outline to more accurately reflect medical assistants' duties and required skills. Notably, the percentage of clinical competency questions has increased, while the percentage of general and administrative questions has lowered slightly. You can download the content certification exam or expand the full content outline below for a quick glance. So this is the content outline for the CMA AAMA certification exam. Clinical workflow, patient intake and discharge, blood pressure principles and techniques, pulse points and techniques, rate and rhythm, height, weight, BMI, body temperature, techniques and equipment, pulse oximetry, respiration rate and pattern, pay scale, pediatric measurements and growth chart, recognized document, report age-specific normal and abnormal vital signs, medical terminology, medical parts, roots, combining forms, prefixes, suffixes, diagnostic procedures, surgical procedures, interviewing techniques, obtaining concise and accurate reporting of relevant information, open-ended exploratory questions, closed and direct questions, documentation of care, chief complaint, subject data, present illness, review of systems, past medical history, reconciliation of medications or allergies, family history, social or occupational history, objective data or examination, treatment and compliance, and making addendums or corrections. Patient screening and wellness assessment, cancer prevention and screening, prevention, screening of sexually transmitted infections, nicotine risks and cessation, recognition of substance use or addiction, osteoporosis screening, domestic violence screening and detection, suicide awareness and response, and depression screening. Processing provider orders, diabetic teaching, instructions on use of mobility equipment and assistive devices, pre- or post-procedural or treatment instructions, patient-administered treatments and medications, home monitoring, alternative medicine, nutrition, counseling, basic nutritional elements, carbohydrates, fats, proteins, and amino acids, minerals, and electrolytes, vitamins, fiber, water, function of dietary supplements and herbs, special dietary needs, weight control, diabetes, cardiovascular disease or hypertension, cancer, food sensitivity, intolerance, kidney disease, food label interpretation, and eating disorders. Then safety and infection control, infectious agents, bacteria, viruses, protozoa, parasites, fungi, and yeast, infection cycle or chain of infection, the body's natural barriers, modes of infectious transmission, direct and indirect, standard precautions and exposure control, occupational safety and health administration, personal protective equipment, hand hygiene, post-exposure protocol, eye wash station, sharps and needle safety, medical asepsis, sanitation, disinfection, cleaning, biohazards, disposable regulated waste, blood, body fluids, and body tissue disposal, spill kit, when and how to use, safety resources, safety signs, symbols, and labels, safety data sheets, globally harmonized system of classification and labeling chemicals, safety and emergency procedures, workplace safety, emergency preparedness, evacuation, crash cart supplies, equipment, fire prevention, regularization, and extinguisher, emergency management, identification and response, basic first aid, bleeding control, burns, cardiac and respiratory arrest, foreign body obstruction, diabetic ketoacidosis, insulin shock, bone fractures, poisoning, seizure, shock, cerebrovascular accident, syncope, lacerations, avulsions, punctures, and abrasions, cold and heat exposure, joint dislocation, sprains, strains, asthmatic attack, hyperventilation, animal or insect bite, head trauma, and chemical exposure, body mechanics or ergonomics, risk management, quality assurance, and safety procedures, reporting safe or unlawful activities and behaviors, conflicts of interest, incident reporting, patient safety, variance reporting, procedures and examination, preparation for patients for examinations, procedures and treatments, examination methods, auscultation, inspection, mensuration, palpation, percussion, body positioning, dorsal recumbent rollers, knee chest lithotomy, prone, sim, supine, pediatric examinations, obstetric and gynecological examinations, supplies, equipment, techniques, and patient instruction, eye irrigation, ear irrigation, suture, staple removal, cast care, splints and slings, surgical assisting, surgical asepsis, surgical scrub, surgical tray, antiseptic, skin prep, wound care, chronic and healing, bandaging, dressing, change, post-op, incision care, ostomy care, instruments, classifications, identification, use, sterilization techniques, autoclave, preparing items, wrapping items, sterilization indicators and quality control, measurements, anatomy and physiology, human growth and development, normal development patterns, milestones across the lifespan, structural units, cell, tissue, organ, anatomical division, body cavities, anatomical positions and directions, body planes and quadrants, body systems, normal structure and function, integumentary, musculoskeletal, nervous, cardiovascular, lymphatic, respiratory, digestive, urinary, reproductive, endocrine, sensory, body systems, abnormal structure and function, recognition and etiology, integumentary, musculoskeletal, nervous, cardiovascular, respiratory, digestive, urinary, reproductive, endocrine, and sensory, specimen collection techniques, method of collection, blood, venipuncture techniques, equipment, needles, tube, additive, specimen preparation, capillary dermal puncture, urine, random, midstream clean catch, timed collection, catheterization, pediatric urine collection, drug screen, chain of custody, fecal specimen, sputum specimen, swabs, throat wounds, and nasopharyngeal, and then to prepare, process, and examine specimens, proper specimen label, sources of specimen contamination, specimen preservation, refrigeration, fixative, centrifuge, microscopic, wet mount, laboratory quality control, quality assurance, and clinical laboratory improvement act, requirements, testing records, and performance logs, equipment calibration and maintenance, quality control, testing, monitor and document temperature controls, laboratory panels and selected tests, urinalysis, physical, chemical, microscopic, hematological, hematocrit, hemoglobin, erythrocyte sedimentation rate, ESR, automated cell counts, red blood cells, white cell differentiated platelet, coagulation testing, chemistry, metabolic testing, glucose, kidney function, liver function, lipid panel, hemoglobin A1C, electrolytes, thyroid functioning, specialized testing, mononucleus, rapid group A streptococcus, C-reactive protein, HCG pregnancy test, H. pylori, influence, genetic hereditary tuberculosis tests, cardiovascular electrocardiography, perform standard 12 lead, recognize and eliminate artifacts, recognize rhythms, arrhythmias, Holter event monitors, cardiac stress test, vision, color vision, visual acuity, near vision, distance vision, ocular pressure, visual fields, audiometric, hearing, pure tone audiometric, speech and word recognition, tympanometric, allergy, scratch test, intradermal skin test, patch test, respiratory pulmonary tests, spirometry, peak flow rate, diagnostic imaging, differentiate between normal and abnormal lab and diagnostic test results, pharmacology, medications, classes of drugs, drug actions, desired effects, indications for use, adverse reactions, side effects, allergic reactions, contrainterdictions, storage of drugs, inventory control, preparing, administering oral and perinatal medications, rates of medication administration, dosage of medications, metric conversion, units of measure, calculations of medication dosage, routes of administration, including safety precautions, intramuscular, Z-track, subcutaneous, oral, sublingual, buccal, topical, transdermal, inhalation, installation, intradermal, site selection, needle length, and gauge in medication, documentation, and administration of medications, reporting medication errors, immunization resources, Centers for Disease Control and Prevention, adult child immunizations, record keeping for immunizations, vaccine information statement, vaccine adverse event reporting system, and vaccine storage, General legal and ethical issues, Health Insurance Portability and Accountability Act, HIPAA, maintain confidentiality, patient right, verbal and written, health information technology for economic and clinical health, high-tech, patients' right to inspect, amend, and restrict access to their medical records, patients' bill of rights, legislation, patient care partnership, security of transmission of information through encryption, password firewall, and activity log, protected health information, PHI, authorization to release, drug and alcohol treatment release, HIV-related information, mental health records, genetic information, Non-Discrimination Act of 2008, release for continuity of care, authorization to resend and release, use and disposal of HPI, consent, informed written, implied verbal exceptions, mature or emancipated minor, dependent adult emergent situations, federal and state regulations, professional liability towards negligence, slander, libel, abandonment, battery, assault, current standard of care, legal terms and doctrines, subpoena, disposition, respondent superior, Good Samaritan laws, contracts, legal obligations to the patient, termination of medical care, elements, patient notification or documentation, pharmaceutical laws, prescribing drug schedules, controlled substances, use and abuse, mandatory reporting, public health statutes, communicable disease, vital statistics, abuse, neglect, wounds of violence, ethical standards, behaviors, decisions, and reporting, medical directives, advance will, living will, medical durable power of attorney, patient self-determination, act, communications, interpersonal relationship skills, and customer service, understanding human behavior and mental health, defense mechanisms, recognition and adaptive responses, identify and adapt approach to communication barriers with empathy and compassion, death and dying, terminal illness, visually hearing impaired interpreter, non-English speaking, English as a second language interpreter, Americans with Disabilities Act, Amendments Act, compliance, illiterate, intellectually challenged, age-specific therapeutic adaptive responses, geriatric, pediatric and adolescent nonverbal communication, personal boundaries, de-escalating techniques, listening skills, and service recovery or patient satisfaction. Then therapeutic adaptive responses, cultural and diversity in beliefs, recognizing stereotypes and biases, displaying impartial conduct, learning styles, assessing and adapting to the level of understanding, identifying and overcoming barriers to communication, healthcare team roles, understanding communication, plan of care, and referral coordination, serving as a patient navigator, advocate, or case manager, health coach, utilizing a team approach to patient care management, identifying medical specialties, professional telephone etiquette or techniques, message protocols, screen gathering data, administrative coding, applications, procedural coding, upcoding, downcoding, bundling, unbundling of charges, diagnostic coding, healthcare common procedure coding, link of procedure and diagnostic coding to meet medical necessity guidelines, insurance fraud or abuse, coverage for patient services and waivers, insurance eligibility verification, insurance claim submission, explanation of benefits for patients and providers, claim rejection and follow-up, tracking unpaid claims, advanced beneficiary notice, insurance and third-party payers, commercial plans, Medicare, Medicaid, Advantage plans, Medicaid, state children's health insurance program, CHIP, TRICARE, managed care workers' compensation, authorization and resources, pre-certification and prior authorization, diagnostic and surgical procedures, medications, drugs, formulary, denials, appeals, financial terminology, accounts receivable, accounts payable, debits, credit balance, deductible, patient account and final procedures, post charges, post payments, post adjustments, write-offs, end of day reconciliation, financial calculators, billing collections, itemized statements, aging of accounts, collecting payments, pre-planned payment options or credit agreements, use of collection agencies, account collection rules, scheduling appointments in health information management, scheduling appointments in new patient and established patient, routine versus urgent, coordinate facility, equipment, personal requirements, ancillary sources, cancellations, no-show, physician delay or unavailability, medication, reception and patient registration, patient identification, obtain patient demographics, identify theft protection, obtain accurate billing information, and electronic health records, patient portal, recognize, identify, and organize medical reports, history and physical, discharge summary, operative note, diagnostic test, laboratory report, clinic, progress note, consultation report, growth charts, graphs, tables, medical record, preparation, visit planning, and obtaining a copy of a patient's outside medical record and or after pertinent test results.